Hello, good day everyone. Welcome. You're watching Liberate Yourself from Chronic Pain with Stephen Simon on this snowy January day. It's a Friday today, I believe. I think that it's super snowy, but it's not cold out, you know. Um, so I'm on my way to the hospital to do my blood work, which I get done at the beginning of every month. I do blood work so they can check my levels and make sure I'm not going into crisis. And it also lets them know how much, like what my medication should be, how many milligrams, what level I should be taking for my hydroxyurea. Okay, so, but I thought today I would talk about when you go into emergency. Oh, look, I got some snow in my beard. Permanent snow. I would talk about like when you're going into emergency, you know, just kind of how to behave and how to get what you want. Hopefully, um, you know, people with chronic pain, because they take so much pain medications, you know, they have trouble going into the emergency and getting what they need for pain, because sometimes the doctors think that they are seeking drugs, right? Because our pain medications are narcotics. So sometimes they think that we are seeking drugs. It's really snowy out here today, as you can see, but I'm dressed for the weather. I'm bundled up and I got my big heavy snow boots on, but you can't really see that. I don't know, but I don't really wear them that often, but today is a day that I definitely need them. Anyway, so when you go into emergency, you know, the first thing you do is you register, right? You register with the nurse and give them your health card, that sort of thing. And so what you want to do is, you know, you provide them with your health card and stuff. And I have this card here that lets them know I need to be seen immediately. Okay, as fast as possible, because my pain is super, super, super severe, right? And I know it goes on how, you know, the first person with the worst sickness gets seen, right? First, like if you come in and you have bloodshot, or you can't breathe, or you're having a baby, you're going to be seen before everybody else that's just coming in for maybe a rash or something like that, right? So I have this card here that lets them know. It says emergency management, sickle cell disease. This patient requires prompt management. Okay, ideally within 30 minutes. It lets them know I need to be seen ASAP. Okay, now I've had this card, I've shown it, and I've waited longer than 30 minutes, but that's because other people, you know, need to be taken care of before me. So try not to get upset. Try not to be cursing the nurses or the doctors like, I need to see a doctor! You know, try not to get crazy and causing a scene, because they'll just call security on you and kick you out. You won't be seen at all, right? That doesn't help, okay? So this card also lets them know, do not transfuse blood for uncomplicated pain crisis, okay? Says that there at the bottom in yellow. Also, when I open it up, okay, it lets them know if I have any allergies, what what I'm diagnosed with. And this is, you know, I could be not able to speak, not able to communicate what's wrong with me, and I just give them this card and they know what I need, okay? I keep it in my wallet at all times, and it's just something that I carry with me, like my identification in case anything happens. Okay. Now, I realize that not everywhere has this program, but talk to your doctor about, maybe you can implement something like this because this helps. This helps me get into triage in emergency a lot quicker than if I didn't have it. Right? I come in and people are waiting, and I get my name called quickly before they do, just because I have this emergency access card. Okay, so it also tells what's my recommendation for pain management. For me, it's Dilaudid and or ibuprofen. I think it says there at the bottom, 400 milligrams, and then also the Dilaudid, currently 2 milligrams, but it used to be higher. It used to be between 4 to 6, and I remember I went into emergency and the doctor still gave me like 2 milligrams, and that barely touched the surface of my pain. And once they saw that it was continuously not helping, then they gave me the 4 to 6 that I needed originally, like, an hour later, or maybe even 2 hours later, in triage waiting, once they seen that my pain wasn't easing up, because when you're in pain, people can definitely see it. Okay, especially if you're in a crisis with sickle cell anemia. Um, so, but the main thing is to like be respectful to the doctors and nurses. Um, I have had instances, um, situations where I just couldn't help myself. Like, these people are pissing me off. They're not helping me. They're like think I'm seeking drugs, and it's frustrating and everything. But try and keep your cool because it doesn't help you see them any faster. In fact, they'll even take longer to get to you on purpose. Okay, so be respectful. Be nice. Be courteous. Think of like the other people that are there in front of you, and sometimes you may just have to like internally, take deep breaths. And I know you're in pain. I trust me. I know what that feels like, and it's hard. I'm up, walking around, pacing. I can't sit still. I know it's really, really challenging, but at the same time, like if when you're rude to them, when you're cursing them and stuff like that, they don't like that. They'll call security for you, like I said. Um, so, have I had security called on me? No, not. I don't think so. I haven't actually, but I do know a time that I was in triage and I have already been given my medication, but I was hallucinating, right? I was hallucinating, and that's when they called. I was trying to leave the hospital actually, because it felt like I was just sitting there and or laying there, and nobody was helping me. I don't know. I was just tripping. I was on a trip, so security was called on me then, and they just brought me back to my bed. They didn't kick me out or anything like that, but I wasn't cursing and stuff like that. But I have had times where I have like loose lipped the doctors and the nurses, and we're like, well, not really the doctors, but the nurses, because you're there calling them, and they're just ignoring you, or they're not your nurse. Somebody else is there, and it's something so simple that if they just turn their head or acknowledge. I think that's the thing that really pissed me off, is that they could hear me and think, but they just weren't acknowledging that hey, I need help, and that really just hit my nerves. But try not to do that. I don't recommend you do that, because they really don't like it, and it's not gonna help you get in help any faster. Now, once you get registered, once you get admitted into the hospital, um, if you have any problems on your floor, again, don't curse the nurses and stuff like that. Just take it to the head nurse. I've had a situation where I had to just take it to the head nurse. I think they wanted to put me in in a ward. You know, I hate wards um, with a passion. And I'm in a ward. I close my curtains all the way around, and I'm just in my own little bubble in my room. But I had insurance, you know, to be get into a semi-private room, and they were switching me into a ward, and I just that really you know, I just took it to the head nurse, and then they made sure I got what I was asking for, you know, which I had insurance for. I pay for it, and so please do not put me in a ward. You know what I mean? Um, yeah. So anyway, I want to let you go now. I'm gonna go get my blood work done. I just want to let you guys know that, you know, kind of how to behave in the emergency when you're sick, and you know, try to get this card implemented if you don't have it in your city or whatever, you know, wherever you are. Talk to your hematologist. That's who did it for me. My hematologist is the best. She just like she really looks out for me. Her whole team is just amazing. Anytime I need anything, I just call up one of the nurses. I have her cell phone number, and I got work her cell phone number. And when she's there, she like helps me pronto. I'm gonna be traveling in a couple days here, and I need to get my fluids done. I called her just you know, with short notice, and she's making sure that I get that done. So, you know, when you have a good team, good network of physicians, and it makes your sickness really a lot easier to go through. Okay, and your healthcare program a lot easier to go through. So share this video, like this video, you know, subscribe to the channel, and I look forward to talking to you soon. Okay, take care. Love ya. Bye.